Many of the ideas I share on this channel come from F.M. Alexander. He was known as the breathing man because improved breathing was one of the major benefits that was gained by using his technique. So you may wonder why I don't talk more about breathing specifically. Today we're going to look at two basic concepts around breathing, but first I'll explain why I don't speak explicitly about breathing all that often. From Alexander's perspective, good breathing is dependent on the general coordination and posture of the person. Rather than training the breathing specifically, he trained the coordination of movements that produced the appropriate posture. To quote him, "I regret his employment of the term back breathing, since I consider it dangerous as suggesting to the pupil that the act of breathing is of primary importance, and that he is to perform it with a particular part of his body. As a matter of fact, given the perfect coordination of all the parts as acquired by my system, breathing is a subordinate operation, which will perform itself." Many common breathing exercises involve exaggerated sucking in and blowing out of breaths, or in some cases expansion of the belly, or movements of the head in order to take so-called deep breaths. Alexander clearly believed that by reorganizing the torso and entire body, you could allow the breath to naturally flow in and out. That while specific intentional movements could produce good posture, which would indirectly produce good breathing, most breathing exercises cultivated specific intentional movements related to the breath itself, and those movements were almost always counter to good breathing. He was harshly critical of the breathing exercises of his time, which often deformed the children that were taught them in school. While the exercises of today are perhaps not as bad, many of them do ask you to cultivate habits that are completely wrong from Alexander's perspective. The first idea to bear in mind with breathing is that we do not want to audibly suck air in or blow air out. When you hear someone sucking air in, whether through their nose or mouth, what you're hearing is them speeding up the air. The first issue is that this will irritate the mucous membrane in the throat, which is part of why many singers and speakers lose their voice. When air flows in the nose slowly, the hairs in the nose are better able to do their job of preventing unwanted things from entering the airway. The second issue is that this increase in the speed of the air being breathed will tend to narrow the airway. The airway is a tube, and when you accelerate the air in a tube, you reduce the pressure against the walls of the tube. Since the airway is a flexible tube, you will end up restricting and narrowing the tube as you breathe in, which is counter to what you want when you breathe. So from Alexander's perspective, a breathing exercise that requests that you audibly suck air in or blow air out is one that is asking you to cultivate a bad habit of breathing. The second idea to keep in mind with breathing is that we do not need to expand the abdomen or lower ribs when breathing in. There is a common misconception that the belly should expand with each breath. I've spoken before about how there simply are no lungs in the belly, and so expansion here to breathe makes no sense, as that expansion will also tend to prevent expansion in the upper rib cage, where the lungs are. Masoero also points out that a large portion of the center of the diaphragm is not muscle, but actually fascia. For that fascia to function properly, it must be taut. If your abdomen is pushed forward, your abdominal region will become more wide and short, as we looked at last week. Whereas if you lengthen the back and lift the rib cage, you can produce a more narrowed and tall abdominal region. Doing this will make the fascia taut so the musculature can work efficiently. Remember, taut fascia does its job of resisting the pull of a muscle, which allows the muscle to do its job. If the fascia is not taut, the muscle will have to work to pull the fascia more taut before it gets the resistance that it needs. When the diaphragm is engaged to breathe in, if the fascia is not taut, a lot of the diaphragm's contraction will work to eradicate the slackness of the fascia, meaning you are going to breathe less efficiently. you'll be wasting a lot of the work of the diaphragm. So a game we can play with these ideas is to see if you can narrow the lowest ribs as you breathe out, and then can you breathe in without expanding the lowest ribs or protruding your abdomen. You also want to lift your rib cage up away from your pelvis. We can again use this tall, narrow X idea we looked at last week. Of course, when you lift your rib cage, you must make sure you're not pulling your upper sternum back, which will be most people's first inclination. You might find that you have to expand your upper rib cage, where your lungs are, more if you don't allow the habitual expansion of the abdomen to breathe. You may also find that you breathe more into your back. But remember, you must also lift your rib cage the whole time as you do this to lengthen the fascia. We are not applying different directions to the breathing in versus the breathing out. The rib cage will expand with the breath, but we are not heaving to get the breath in or dropping to get the breath out. Because the fascia is taut, the diaphragm can efficiently produce a partial vacuum in our lungs and then allow that vacuum to fill with fresh air. The last thing I'll say on this is that many people are habituated to the feeling of air rushing into and out of their nose or mouth. And so, if they breathe in a way that does not produce this feeling, they feel like they're not breathing. I've had several people make that comment. I said it myself years ago. But I can assure you, none of these people have passed out or died, so they were in fact breathing. It sounds funny, but our feeling sense really is this unreliable, even about things as simple as breathing. I know this conception of breathing may sound bizarre or wrong at first. You might think this sounds counter to everything you've heard about breathing. Restrict the expansion of the ribs? But remember, we're only narrowing the lower end of the rib cage where there are no lungs, and we are providing the leverage our diaphragm needs to act efficiently by getting the fascia taut. We'll have one last basic approach video next week where we look at what it means to use our mind to guide our actions. In the meantime, you can try these breathing ideas out. And if you'd like some assistance and guidance in putting these ideas and other ideas related to posture into action, I do offer lessons given one-on-one over Zoom in the initial Alexander technique. In these lessons, you will record yourself through Zoom and really see your posture and what your habits of movement and breathing are. For more information, visit my website, mechanicsofpoise.com.